And a good morning to you. It is Monday, September the 14th. We are so happy to have you with us. Did you have a good weekend? I hope so. Weather was a little sketchy at times, a little bit of rain, a little bit of sun. It was all there. Of course, hopefully you had a good weekend. Brittany Pacheco always has a good weekend. She lives for the weekend, and she joins us again this Monday morning. Good morning, Brittany.
Hey, Todd. Good morning. My weekend was filled with a lot of reading. I'm just going to leave it at that. But yes, it was a nice weekend. Yeah, weather was a little sketchy, but we're here today, this Monday morning. And I always remind everyone who is watching us, we first of all, thank you for joining us this morning on Up to the Minute, but also take the time to follow us on our social media pages, Facebook, Twitter, and Instagram, and YouTube. And lastly, be sure to share this podcast so that we can grow our audience. And it's just a simple click of one button to share to your personal profile so we can share this great information to everyone.
Well, Brittany, I had an experience over the weekend. I'll tell you about it later, but I will tell you it was another theater experience with only like 5 people in a theater. It was really cool. We'll talk about that later on in the show. Raquel Sims is here. She's joining us this Monday morning for her Monday morning report. Good morning, Raquel. How are things going out in Stafford?
Good morning. Things are going great out here in Stafford. I definitely missed y'all last week because I wasn't here Monday for the Labor Day holiday, but I am back I'm happy to be back. Sorry.
We're glad to have you with us. We'll have more with both Brittany and Raquel coming up. But right now, we're going to introduce our 2 guests for this morning. We're going to talk about a very important topic for many of our faculty, students, and staff, especially ones who are expectant mothers or ones who maybe have had a child recently. You definitely want to stay tuned for this. Or if you know someone who's recently had a child, well, make sure you share this show, share this podcast, and we'll get the word out to them. We've got 2 guests today. First off, Deborah Mouton, Deborah D.E.E.P Mouton, and she is the writer and Houston Poet Laureate Emeritus with the City of Houston. That's a great title. Good morning, Deborah.
Good morning. Thank you so much for having me this morning.
Absolutely. We'll be back with you in a second. And if you have any answers to the questions, feel free to pop on in. And the person who's sharing the interview with Deborah is Yvonne Harrison. Yvonne is the chair of Improving Mental Health Awareness Committee here in Houston. And we want to thank you for joining us talking about this very important topic. Yvonne, tell us about what your organization is all about, Maternal Health Initiative, and how did you start out?
Good morning, Todd. Thanks for having us today. Let me go back a little bit. Back in 2017, the Improving Maternal Health Initiative started its research phase, and the main focus at that time was on the issue of maternal mortality, which are deaths that happen either during pregnancy or postpartum. And the postpartum period, or the 4th trimester, is up to a year after a woman has a baby. And at that time in 2017, it was unfortunately announced here in the state of Texas that we lead the country in terms of the rate of maternal mortality. And the United States actually leads all developed countries in this same statistic.
It's a disturbing trend here in Texas, but why is that? Why are we leading the nation in this? Maybe you can shed some light on that subject.
Well, it's a very important question. It's obviously a very powerful question, but Todd, it's one that has no simple, easy answer. There are women health outcomes that need to be reviewed. There's the concept of maternal morbidity, which is simply put, sickness that can happen during pregnancy, which leads to complications. And we know that among African American women, they are more highly likely to have these morbidity complications that then lead to death. But we're looking at things like access to insurance, access to contraception, Medicare access, substance abuse, mental health, all these different factors. And if I can mention, Todd, too, also the impact of bias and the role that bias plays in healthcare and its outcomes.
Let's talk about that bias, and maybe you can explain that a bit deeper for us. And I guess when people think of a woman having a baby, the focus falls on the baby. For what you're telling me, we really need to focus on mom as well to make sure she's healthy. And you're talking complications that happens. I imagine those could be a combination of physical and possibly mental complications that happen as well.
Absolutely. So you're right. We do focus on baby during pregnancy, and rightfully so, but more emphasis needs to be put on the health of mom. And, as we walk through this issue and look at the outcomes, we understand specifically the role of bias as it relates to African American women, and not only their health care during this maternal season of their life, but throughout their season of life. Todd, there's some bias, there's some stereotypes that some healthcare providers have as it relates to treatment of African American women during this time. And Deborah, who's also on this program, has some really powerful experiences related to that. But one example that I'll mention is this bias or stereotype that African American women have a higher threshold or tolerance for pain. So as many of your guests will know and understand, pregnancy is not comfortable, but it should not be painful. So normally pain is an indication that something has really gone wrong, that there's something that needs to be course corrected. But this bias can kick in and prevent an African American woman from having the treatment that she needs when she triggers that there is a pain event.
Deborah, I want to bring you into the conversation because you believe you experienced bias during your pregnancy for your children. Maybe you can tell me a bit about your experience and also the misconception of the tolerance of pain. Can you address that as well?
Absolutely. My children both had kind of two traumatic events. The first one, I was in labor for about 48 hours with my daughter. So, a full 2 days of kind of trying to get this child into the world. With my son, it was faster because we kind of planned a C-section. But even after that, I remember having the stitches removed, from the C-section, and a nurse standing over me and clipping, stitches out of me, and me saying, this is hurting, and screaming, and her telling me that I was overreacting and that it didn't hurt that bad and that I was going to be okay. And I needed to be quiet because I was disrupting other patients. Right. And this is something that I heard multiple times within my experience with doctors was, that you need to be quiet, or you need to settle down, or it's going to be all right. It doesn't hurt that bad. And I think that is absolutely the bias that we kind of see Yvonne talking about, resonating through this experience of having children.
Tell me a bit about, if you could, going into a pregnancy, especially your first time, what do you wish you would have known prior to giving birth, going into that first time having a baby?
Absolutely. I think I came in as a mom who had, the written birth plan and the mixtape already made for when my child was going to be coming into the world. I had this really prescriptive way that I was approaching it. And I think a lot of mothers do, we dream of this moment of holding our child and bonding with it. And I think for me, I didn't know that that plan would go awry. And there was never a discussion of what would happen if that plan didn't work the way that I expected it to. And so when I found myself, unable to actually deliver regularly and needing an emergency C-section, it kind of was a whirlwind of rush. There wasn't very much communication. It was just kind of, we got to do this now. We got to take this next step. And then even when I was in the delivery room, the woman next to me crashed and they needed to take my staff to move to her because they were already scrubbed in. That kind of made sense. But I was just kind of left exposed there for a long period of time while they dealt with this other patient. And then when they came back in, there was no discussion necessarily of what happened or why that needed to happen. My heart rate was elevated. My child's heart rate was elevated. And then I ended up having to be put under and sedated completely because my body wouldn't stop trembling, right? So I think that even just some simple communication along that line would have really helped serve to make me feel more comfortable. And I think knowing that these things arise and sometimes there's going to be this change of course, I would have taken a different approach to coming into both of my pregnancies.
Yvonne, hearing Deborah's experience, I imagine this is not an uncommon thing that you're hearing. And is this a hidden health crisis that we're facing here in Harris County with situations like what happened to Deborah?
Unfortunately, it's not uncommon. And to your point, It is a hidden health crisis, but one of the focal points for Improving Maternal Health Houston is so that it's no longer hidden. This has been happening for quite some time in our community, and I'm still shocked at the number of people who actually lend me their ear on this topic, who look at me sincerely and say, I had no idea this was going on. It has increased, or awareness for this topic has increased, as you've noted, maybe some celebrities over the past couple of years who have talked about their pregnancy complications. But this is not an issue for celebrities. This is happening every single day in our community. Women are becoming gravely sick. Women are dying. Children are having to come into the world and their mothers are not here from them because of issues and complications that are largely preventable and also too easily resolved once identified. And that's the tragedy.
Let's talk about what we can do now to prevent this in the future. Are there support groups? Are there educational programs? How does one get involved, and how are you getting your message out there?
Well, thank you to the team this morning for being a part of that solution and increasing awareness. We are looking for channels like this, avenues like this, just to simply let people know this is going on. Once people know it's going on and it's happening, a lot of people say, how can I help? What can I do? So I think on a micro level, if you know someone in your community, in your family who is pregnant, offer greater support. Ask them how their doctor appointments are going. I know during this time of COVID-19, there are restrictions on your ability to take a visitor or a guest with you to a doctor appointment, but ask to be on FaceTime. If the mother doesn't know what questions to ask, sometimes just having a support system for those doctor's appointments can make all the difference. Be that support. Be that support postpartum if you start to see changes in a woman's mental health, or if she just needs some help, some support, if she's still in pain, if she is complaining about some bleeding or some physical ailments that are just not common. Be that ear and help to connect her for her health to her healthcare providers if she is not able to do that on her own.
Can I add to that?
Yeah, go right ahead, Deborah.
As the mothers, we need to also be kind of empowered to be able to speak our piece and say when we don't feel like things are right, to ask doctors to notate your accounts when they don't listen to the things that you're saying are wrong, and just to really be more vocal and more proactive in putting our foot down and asserting that we deserve a certain kind of treatment and a certain kind of attention when it comes to us in this special time of our lives.
Absolutely.
Let me ask both of you this, and Yvonne, maybe you can address this first. We're living in an age of COVID right now. Many of us are very isolated. I would imagine this could be a very dangerous situation for someone who's recently had a baby who may be alone with the child. Does that concern you there, that we're living in a virtual isolated world?
Well, we have to stay safe due to COVID-19. But I would say for a woman who has just had a child, staying safe, but trying not to fall into the dangers of complete isolation. You need to have the ability to connect to those in your trust circle. And then your trust circle needs to have active steps that they're taking to supporting you. Even if physically you're okay health-wise, isolation can cause a number of mental health issues. So for those of us who know women who have just had children or who are in pregnancy stages, are we reaching out? Can we have groceries delivered? Can we have food delivered? Again, providing that physical or virtual support for doctor's appointments. And even, Todd, something as simple as a phone call or FaceTime call to mom can make all the difference right now. And those are things that sometimes we tend to take for granted, or can simply say, oh, she just had a baby, she's really busy.
Right.
But don't underestimate the importance of outreach during this time.
And Deborah, I'll ask you the same question. Living in this age of COVID, what would be your advice to mothers out there who may have just had children or who are expecting when we're still in a shutdown phase somewhat?
Right. I would say, I think a lot of the reasons why as a mom we justify that the things that are happening us are okay is because we've heard pregnancy and raising children is hard. And so you kind of just justify that, oh, this is just the part of the hard part everyone talks about, instead of acknowledging like, yes, it can be difficult, but it should never be unbearable. And when you find yourself at the point where you're at your wit's end and you have no more, that it's legitimate to say, I'm kind of at my end and I need support and I need help. And that doesn't make you weak. That makes you strong enough to know where your limits are. And that makes you willing to be able to speak up and lean on that trust circle to say, even if it's just, can you sit with the baby for a moment? If you have time, you have that trust circle of someone who can do that for you. But especially in COVID, to say, I just need a break. I need to talk to another adult voice. That was something that I definitely needed, right? Just to have an adult conversation that wasn't about children for just a minute and feel like I was kind of plugged back into the world in a way that wasn't identifying me only as a mother, but acknowledging that my motherhood does influence the way that I look at the world.
Deborah, I want to ask you about your poetry. And back in my news days, I did some stories with the Project Row Houses. Tell me about your work with them most recently.
Absolutely. I had the honor of joining Healthy Women Houston, which is also partnering with Improving Maternal Health, and looking at creating pieces and performing pieces that talk a little bit about motherhood. And my latest release, Newsworthy, which this is the cover here, actually has a piece in it that is dedicated to my son, who, I had a really traumatic pregnancy with him, and I didn't write about him for maybe the first year he was born. And the first poem that came out was kind of this reclamation poem that lands in the book. And so I was able to perform that at Project Row House and kind of lead this discussion and this conversation about what it means to reclaim space for yourself as a mother.
And tell me what DEEP stands for in your name.
Absolutely. It's determined to excel in everything promised. So looking at the things that God put me on this earth to do and really just holding on to those as measures of success.
For anyone wondering, we're going to have links to Deborah's works and to the organization in this social media post. We wish you both the best of luck in getting this word out there. It's a very important subject, something unfortunately that many of us may not know about and that we need to be educated on. So I am very honored to have you both on here to shed some light on this subject. And I do encourage you to share this post and help get the word out as much as you can. Yvonne, if someone wants to get a hold of you or to reach out to your organization or simply help out, how can they do so?
The organization is Improving Maternal Health Houston, which the website is imhouston.org, and all the social channels are at imhouston.
And once again, we'll have those links and their handles in the social media post. We thank you both for being here today. It's a very important subject, and we're very pleased to be speaking with you this morning.
Thanks for having us.
Thank
Absolutely.
you for having us.
Thank you. All right, we are going to move on to some HCC news and information. Brittany, Raquel, a little bit different subject for us this morning, but still important information that we need to get out there.
Yeah, definitely. I mean, as you said at the top of the show, before we introduced our guests, that, this is completely important information for our HCC family, students, faculty, and staff who may be having a very private, experience that they are not really willing to talk about because for whatever reasons they don't. But to know that this is actually a real crisis and that there is help out there to support women and their families, it's a resource that everyone should utilize and pass on to others who may be having that silent struggle.
Absolutely. It's a silent crisis, and we hope to get the word out there, at least letting people know more about it. Raquel, I want to start with you. Good morning again. I want to start with you with the HCC news out in Stafford. How are things going out there in Fort Bend County?
Things are going good in Fort Bend County. Last week, we actually had a chance to speak with the principal for the Early Childhood Center, Ms. Twyla Hines. She is actually, giving insight on the importance of, getting your child in early, like starting early, the Early Childhood Center. This is something new that they haven't had. And so they're just excited to get the word out there and let them know the importance of fueling your child's brain at a very young age, getting them started early, with just hands-on activities and stuff. So I was able to speak with Ms. Paula Hines about that. I also had a chance to speak with Heather Hernandez-Cedillo. She is the executive director and the co-founder of Reigning Strength reinforcement therapeutic program, and that's out in Richmond. And she just pretty much gave me insight on how they've adjusted due to COVID-19. You know, they're an in-person organization that works with children with disabilities to help them with their cognitive skills. And, you know, they ride horses. So they had to come up with unique ways to create that safe environment for their students, you know, with still practicing social distancing and also creating a fun activity. They did stuff on Zoom as well, as everyone is. But she was able to shed some light about that. And then also Randall Williams, I think this is super cool, had a chance to speak with someone at the Museum of Fine Arts Houston and how they are integrating the game Minecraft with art collections and getting students involved on that particular level and getting them connected with art collections through a virtual stand. So if you know anything about Minecraft or within the last year and a half, that has like blown up. So to see that interaction and that integration is amazing. And then next week, we're speaking with the tennis coach at the Stafford High School to figure out how their season is going, what they're doing to practice social distancing, and so on and so forth. So that's about it in our area. If y'all are doing so already, please follow us on our Facebook page at HCC Stafford TV Studio and like us on YouTube and follow our YouTube channel at HCC Stafford TV Studio, and our Twitter is HCCSW TV Studio. Thank you so much, Todd and Brittany.
There we go. Turn my mic back on. It's exactly right, Raquel. We appreciate you being here and bringing us up to date with everything that we've got going on. Brittany, one thing I want to talk with you about is we've got Second Start registration underway right now. And folks, it's not too late to register for Second Start.
It's not too late at all, Todd, especially because everyone can register up to the day classes begin, which is September 21st. So if you've been thinking about taking one course or whatever it is that you're wanting to do here at HCC, now's the time to enroll, because now that we're heading towards maybe getting back into the classroom, those classes that are flex campus and lab-based courses are going to be at a very limited capacity. However, you still have those online options of online anytime or online on a schedule. Again, those are 100% online. So if you're interested in registering for Second Start, be sure to head over to hccs.edu/now. And while we're discussing Second Start, I'm going to go ahead and share with you all some dates to remember. Once again, Second Start begins September 21st. You have until that day to register. On September 28th, faculty for in-person classes will return to the campus to prepare for the following week, which is meant for October 5th, where students who are enrolled in Flex Campus and or lab-based courses will return to the classroom to continue their in-person instruction. Once again, those classes are going to be at a limited capacity. So be sure, once again, to head over to hccs.edu/now to register for your Second Start classes and also to learn more about what we have to offer.
That's right, Brittany. All in for HCC. Now more than ever, HCC students need our support. The foundation is raising money. They're asking us, faculty and staff, to contribute to help our students stay on track. Stay on track, I should say. A lot of our students have been furloughed. Many have been laid off. They're having problems coming up with extra cash to pay for college. We can help that problem by contributing to the foundation. You can join the faculty and staff campaign, which is running now through November 6th. It makes sure you sign up for a payroll deduction. It's easy. You'll never miss the cash from your check, and you'll be helping a student in the long run. Help After Harvey, Brittany, it's available right now.
It is. So just like we're going to do our part to help make sure that students are able to get into the classroom and overcome financial struggles, we're doing the same for those who are still who have been impacted by Harvey and are still struggling to get back on their feet thereafter. So the Hurricane Harvey Grant Aid is available to new, returning, and current students. So get your hands on virtual help with questions that deal with tuition and fees, books, transportation, housing, and much, much more, also including childcare. I will say that. There are morning and afternoon sessions available. And if you're interested in participating in one of these sessions, be sure to head over to hccs.edu/Harvey Assistance.
That's right. Rec Sports, they are here for you, and they've got some online events to keep you fit, healthy, happy, and in shape. HCC Rec Sports is still here with all your fall events, including boot camp, Zumba, and you ready for this, Brittany? Twerk fitness, or as we like to call it, hashtag twerkout. I think Nathan coined that phrase, our director, Nathan. Anyway, you can participate in everything from Madden 20, the Gamer League, NBA Bracket Challenge. Yeah, that's all available. A minute to win it. All that and more by emailing recsports@hccs.edu. One college trainer spotlight. What's that all about, Brittany?
So we have two trainers that are being recognized from the One College Testing and Training Initiative. That is Anna Maria Lopez and April Wiggins. Both are from the Enrollment Services team. Thank you for all your help in leading this effort. We know, Todd, we know that our Enrollment Services teams are working probably around the clock to help students get into classes and get their enrollment applications underway. And so we are very proud to recognize these two individuals from our Enrollment Services team.
That's right. And keep in mind, HCC is still offering some free COVID training or free COVID testing sites. I can't talk this morning. It's a Monday morning.
Slow down.
Yeah, it's testing sites that we're offering. Two of them, though, Brittany, are saying that you don't have to have an appointment. They're on the southeast side.
That's correct, Todd. So those two campuses are our Felix Fraga campus and our East Side campus. Now, as you said, both of these sites do not require an appointment. They are open Monday through Friday from 8 a.m. to 3 p.m. And the other sites that we do have, which do require an appointment, are our Northeast campus and our South campus. Now, they're operating from Monday through Saturday from 9 a.m. to 6 p.m. If you're interested in making an appointment specifically at these two locations, be sure to call 512-883-2400. Now, we've been told that it's best to go ahead and make that appointment, but if you arrive and don't have a scheduled appointment, you're not going to be turned away, but it just makes things flow a little bit easier if you have that appointment ahead of time.
That's right. Raquel, have you done your census yet for 2020?
I have. I did it early in advance, but I have done it. But we are still encouraging individuals to fill out the 2020 census because there are a lot of individuals that have not been counted for. So we encourage everyone to do that.
That's right. From what I'm hearing in the city of Houston, I think the mayor came out a few days ago and said about 60% of the city has filled out their census. That's okay, but it's not great. We need everyone to fill out the census because it affects everything that depends on funding. We're talking billions of dollars for public entities like HCC. We need to get a proper head count so we can get the correct government or state funding for our institutions. So if you haven't filled out the census, make sure you do so. It's very easy. You can go online and go to 2020census.gov. Fill out your census today. I believe the deadline has been extended through October. So you have a little bit of time, but we need you to fill that out. And it's anonymous. It won't affect your immigration status. We need you to remember all those things, and please do take a chance to fill out the census. Tomorrow, Brittany, a couple of special guests on the show, including Richard Gosselin.
Yeah, we've had him once before on the show. He is the interim dean of Social and Behavioral Sciences Department, who will not only talk to us about his relatively new position as dean, but also his role in getting faculty up to speed with online instruction. Because let's face it, it's technology is difficult for many people, and to shift from being in-person classrooms to online classrooms, that's a hard shift to make in a very short amount of time. So Richard Gosselin has done wonders to help our HCC family be able to succeed. And we're also going to be joined by Tiffany Morris of, I'm not even sure how to pronounce that, Todd.
I'm going to say Apexina. Let's
sure,
go with
we're going to go with that. Solutions. And she'll be here to join us to discuss her workshop this week about personal branding. What story are you telling? So that should be interesting.
Oh, okay. The movie story. So I went to the movies again this weekend. I saw Black Panther in the theaters. Hadn't seen it before. Excellent. Loved it. And it was in one of these theaters that has 3 screens. I don't know if y'all been to those, but there's the main screen and there's 2 screens on the side of the theaters. You got to pay an extra $1 to get into the theater, but hey, it was worth it. So it was, I think they call it SX is the type of movie experience. So I saw that over the weekend. Once again, no one at the movies. I think there were 5 of us, including the 3 of us, my wife and I and my stepson, and then 2 other people in the movie. That was it. So now's the time to go see movies if you want to see them in an empty theater.
You're a little late to jump on the bandwagon. That is Black Panther, because when it came out, man, I mean, the guys and I at work, we all got together.
I know
to go
you
watch
guys
it.
were all about it. Yeah.
Yeah, we're all about it. I mean, so and it's appropriate timing, of course, since the passing of Chadwick Boseman, right. Black Panther, Wakanda Forever, and it's a really great movie. I thought it was so well done. So I'm glad you got to see it.
Yeah, I wanted to see it in theater. So there you go. All right. Raquel, thanks for joining us this morning. We look forward to seeing you again next week.
Thank you for having me. I look forward to seeing y'all next week too. And I hope everyone else has a great week.
Have a good week, and we will see you, or have a good day, I should say. We've got the rest of the week to go. We'll see you tomorrow, 10 a.m. live on Up to the Minute.